Hi everyone, my name is Shona and this is Anza, Steph and Ebony, and we are second year Monash nursing students from the Peninsula campus. Today we are going to present to you our group oral case study presentation on pneumonia. So we are going to present our case study in the ISBAR format, beginning with identification. Our patient is Ali Parker, a 12-year-old female. Situation: presents with a 2 to 3 day history of a high fever, vomiting, lack of appetite, fatigue and a persistent cough with ongoing chest pain, especially when coughing. Overnight, her symptoms have worsened and she is now having difficulty breathing and keeping oral fluids down. This has caused her mother Jill to become concerned and subsequently she has brought her into the emergency department. Observations: BP 89 on 56, heart rate 62, oxygen sats 90%, temperature 39 degrees, respiratory rate 30 with nasal flaring and grunting. Background: healthy child with no known allergies or comorbidities. Lives at home with their parents and attends a local primary school, but has been resting at home for the past 3 days due to being unwell. Denies recent contact with the healthcare system. Assessment: suspected community-acquired pneumonia with a bacterial cause, Streptococcus pneumoniae, awaiting further investigations. Recommendation or response: awaiting medical review and management plan. So what is pneumonia? Pneumonia is a respiratory condition in which there is inflammation or infection in one or both of the lungs.
You have 2 lungs, one on each side of your chest. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon, and when you exhale, the sacs deflate. Small blood vessels, called capillaries, surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. If you have pneumonia, your airways or lungs have an infection caused by germs, such as bacteria, viruses, fungi, or parasites. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. Hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you may expel them by coughing. Sometimes germs make it past your mucus and cilia and enter your alveoli. Normally, cells of your immune system attack these germs, which keep them from making you sick. However, if your immune system is weakened due to age, illness, or fatigue, pneumonia-causing germs can overwhelm your immune cells and begin to multiply. Your bronchioles and alveoli become inflamed as your immune system attacks the multiplying germs. The inflammation causes your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs.
So symptoms of pneumonia. The symptoms of pneumonia can vary depending on an individual's risk factor and may include cough, fever, rigors, excess sweating or clammy skin, shortness of breath, tachypnea or difficulty breathing, general malaise, fatigue and loss of appetite, nausea and vomiting, abdominal aches or pains, headache, sharp stabbing chest pain that worsens with deep breathing or coughing, and cyanosis around the mouth. In regards to our case study, our patient Ali is displaying many of these symptoms consistent with pneumonia. Risk factors for pneumonia. So some people are more at risk of developing pneumonia than others. These include infants and children under the age of 4, people over the age of 65, heavy smokers or drinkers, people with weakened immune systems, and people with chronic illnesses such as diabetes, lung disease, heart disease, kidney disease, and liver disease. Whilst our patient Ali does not share any of these risk factors, it is well known that anyone at any age can contract pneumonia as a result of its numerous causes. Causes of pneumonia. As touched on in the video we showed before, there are 4 different causes of pneumonia. Primarily, pneumonia is caused by bacteria and viruses, and less commonly fungi and parasites. In respect to Ali, she is suffering from a bacterial cause of pneumonia which can affect anyone. The bacteria causing her pneumonia is called Streptococcus pneumoniae. This bacteria resides in the noses and throats of healthy individuals and can enter the lungs through inhalation, which is most likely what has occurred in Ali's case. Types of pneumonia. Similarly to causes of pneumonia, there are also 4 different types of pneumonia classified by origin. These include community-acquired, hospital-acquired, healthcare-associated, and aspiration pneumonia. Our patient Ali is suffering from community-acquired pneumonia. This is the most common type of pneumonia that is characterised by little or no contact with the healthcare system. Potential complications of pneumonia. The severity of pneumonia can range from a very mild illness requiring little treatment beyond rest to being a severe illness that can be life-threatening. In the majority of cases, pneumonia can be treated successfully. However, some people, particularly those with risk factors, may experience further complications. Bacteremia. Bacteria in the bloodstream, also known as bacteremia, is one of the potential causes resulting in pneumonia. It occurs when the bacteria causing the pneumonia moves into the bloodstream and may travel through the body to infect other organs, potentially causing organ failure. Lung abscess. In some severe cases of pneumonia, a lung abscess can occur. A lung abscess occurs when a large collection of fluid or pus forms within the cavity of the lung. If the abscess forms within the outside of the lung, this is known as emphysema. Both of these conditions can potentially cause permanent lung damage and even death. Pleural effusion. Pneumonia may also cause a pleural effusion. This is when a normal amount of fluid accumulates in the pleural cavity, the fluid-filled space that surrounds the lungs. This excess fluid can significantly and potentially even permanently impair breathing by limiting lung expansion of the lungs. Difficulty breathing and respiratory failure. In severe cases of pneumonia, respiratory failure is one of the leading causes of death. It can occur when breathing becomes so difficult and oxygen is so severely reduced that an individual requires use of a breathing machine called a ventilator whilst the lungs heal. So in moderate to severe cases of pneumonia, early intervention and treatment results in better outcomes. It is our expectation that our patient Ali will not suffer any of these potential complications, given that she is a healthy 12-year-old girl without any significant comorbidities or risk factors. Furthermore, her mother has brought her into the hospital early on in the disease process, which will enable her to receive treatment that will most likely prevent her pneumonia from developing these further complications.
To determine the organism responsible for Ali's illness, a blood test and sputum sample is collected. Once done, antibiotic treatment can be started. Penicillin is a broad-spectrum antibiotic, so it's suitable to use. Start with IV penicillin for the first 12 to 48 hours, then reevaluate, order new tests if there's no improvement. Otherwise, oral antibiotics can continue for the next 7 to 10 days. Treatment for penicillin-resistant S. pneumoniae is penicillin in higher doses. Salbutamol is a selective beta-androreceptor stimulant. It's more specific than both isoprenaline and orchiprenaline for adrenergic beta-2 receptors. Indications for salbutamol are used for relief of bronchospasm in patients with asthma or chronic obstructive pulmonary disease. Absorption of salbutamol is via inhalation. It acts topically in bronchial smooth muscles, and initially the drug is undetectable in the blood. After 2 to 3 hours, low concentrations are seen. The half-life is between 2.7 hours and 5 hours. It's not metabolized in the lungs, but is converted to 4-sulfate ester in the liver. It's excreted following inhalation of salbutamol through the dose is recovered in the urine. A small fraction is excreted in the feces though. Contraindications for use is hypersensitivity to salbutamol, sulfate or expiants. The side effects, headaches, nausea, palpation, sensation of warmth, and mouth and throat irritation may occur with inhaled salbutamol, and cardiac arrhythmias. The safety monitoring is nebules are to be used under the directions of a physician. The solution must not be injected or ingested, and nebules are to be used to achieve bronchodilation as part of the inhalation therapy regime, or for patients requiring assisted ventilation. Because of the possibility of uncontrolled dosage associated with continued administration, intermittent administration of appropriate amounts of salbutamol is preferred. Any solution remaining in the nebulizer after completion of therapy should be discarded to avoid contamination. Nebulizing devices should be thoroughly cleaned after use according to the manufacturer's instructions. Paracetamol is an antipyretic, with no anti-inflammatory properties. It is for antipyretic and analgesic, which both Ali has been suffering from. It's indicated for moderate pain and can be given IV. Paracetamol is absorbed in the GI tract or rectum and is distributed rapidly and evenly throughout a majority of tissue and fluids. It's metabolized in the liver and excreted in the urine. Contraindications are for infants under 1 month of age and liver failure. Adverse reactions are hepatic necrosis and rarely nausea, allergic reactions and dyspepsia. For safe monitoring, IV infusions are given over 15 minutes and IV administrations changed to oral administration as soon as possible. Overdose symptoms include nausea, lethargy, vomiting, abdominal pain. Penicillin should have a baseline assessment before administration. Question allergies, especially penicillins and cephalosporins. It works by inhibiting the cell wall synthesis or activating enzymes. It disrupts the bacterial cell wall, causing cell lysis and cell death. Indications for when a broad spectrum antibiotic is required. Because it's effective against gram-positive cocci and some gram-negative bacteria, it's appropriate to use. Treat a large number of infections, and including pneumonia, which Ellie has. Penicillin is widely distributed, metabolized in the liver, and excreted in the urine. Its contraindications are allergies and/or asthma, renal and cardiac impairments, seizure disorders, hypersensitivity to cephalosporin, and the side effects involve lethargy, fever, dyspnea, rash, pain in injection sites, and rare symptoms are seizures and interstitial nephritis. Safety monitoring involves monitoring CBC, urinalysis, renal function test, and it may increase serum levels and may decrease the white blood count. It crosses the placenta and into breast milk, and for age-related renal impairment, it may require dosage adjustment. Ondansetron baseline assessment. Assess the degree of nausea and vomiting. Because Ellie has been vomiting, it's best to use the wafers so that it can just be dissolved on her tongue and she doesn't have to swallow it and then bring it up again. Side effects. It works by blocking serotonin, both peripherally and on the vagal nerve terminals. Ondansetron prevents nausea and vomiting and will help Ellie to start maintaining fluids and food again. It's absorbed in the GI tract, metabolized in the liver, excreted in the urine, and the contraindications include use of apomorphine. Side effects include anxiety, dizziness, drowsiness, headaches, fatigue, constipation, diarrhea, hypoxia, urinary retention, and occasionally abdominal pain, fever or feeling of cold. The safety monitoring includes mild to moderate hepatic impairment, those at risk for QT prolongation or ventricular arrhythmias, monitoring the ECG in patients with electrolyte abnormalities such as hypokalemia and hypomagnesium, congestive heart failure, bradyarrhythmias, and assessment of bowel sounds for peristaltic.
Nursing management. Airway management is probably one of the biggest things that's relating to this. So Ellie has a documented respiratory rate of about 30 breaths per minute with the nasal flaring and grunting. So, and her oxygen saturation is below 90% or around the 90% with coughing and mucus buildup. So these signs, including her temperature, demonstrate respiratory distress with further investigations required of chest x-rays, blood and sputum cultures, and they'll confirm suspected bacterial pneumonia. The body's response to the bacterial infection is causing increased respiratory rate, secretions, and that's what's compromising Ellie's airway. Ellie's respiratory rate is rapid and she's got an increased work of breathing and increased mucus production. So on auscultation, breath sounds would produce a crackling sound or crackle sound and possibly dullness due to the mucus. So sitting Ellie up in a semi-fowler position will reduce energy in the diaphragm and lungs and therefore make it easier for Ellie to breathe. Regular monitoring of her vital signs and recognition of clinical deterioration are important to Ellie's care. Upgrade to a Metkill when required, and obviously dependent on the hospital protocols which relate to the National Safety and Quality Health Service Standards 9, recognising and responding clinical deterioration. The bacterial pneumonia infection will increase secretion build-up, causing coughing, and respiratory distress. So the coughing should be encouraged to loosen and mobilise secretions out of the lungs. So cough suppressants are not recommended as they actually suppress the urge to cough and then preventing sputum removal. Sputum cultures can be sent off for diagnostic purposes, although it can take up to 3 days for this. So increasing fluid intake can help in altering the viscosity of mucus, making it easier to cough it up. Suction may be required to assist removal of the mucus, although it is quite invasive, so we would try other options first, such as a nebulizer or a humidifier, which is less invasive and it can remove the mucus. The use of nebulizers of saline, salbutamol or high flow humidifiers can assist with the breaking down of the mucus and vasodilate bronchioles to lower resistance. Continued respiratory monitoring with vital signs includes oxygen saturation levels with a pulse oximeter, and oxygen saturation of 90% requires the use of oxygen either by a face mask or nasal prongs.
Nursing intervention, patient comfort and positioning. Many patients with pneumonia suffer from orthopnea and will experience increased respiratory distress when supine. Patient positioning is important when managing respiratory conditions, and Ali should be kept in the semi-Fowler position both for airway maintenance and comfort. Ali has a temperature ranging between 39 to 39.5 consistently. If the temperature is causing stress and discomfort to Ali, then administration of paracetamol or other antipyretic as directed until temperature and discomfort subside. Non-pharmacological measures to reduce fever, such as cool clothing and cool compress to the forehead, are best used approximately 1 hour after antipyretic administration. Nursing intervention, fluid and diet management. Many patients in respiratory distress have reduced appetite. Therefore, management of intake and output is indicated. The use of high-calorie supplements may be useful in Ali's condition to maintain her nutrition. Increased respiratory rate causes increased insensible fluid losses of exhalation, often resulting in dehydration. If Ali is having severe difficulty eating and drinking, enteral nutrition can be considered to maintain her body weight during her inpatient state. Due to her increased work of breathing, Ali may require monitored fluid management. The use of fluid balance and nutrition chart is indicated in Ali's condition. Fluid intake goals for patients in respiratory distress should exceed 2 litres per day unless contraindicated. Due to Ali's age, it can be presumed her body weight would be less than that of an adult. Therefore, these fluid requirements may need to be customised to her body weight. Fluid management for a patient with respiratory distress would include intravenous fluids due to difficulty swallowing excess fluids. Isotonic intravenous solutions are most effective for fluid management in paediatric patients with severe pneumonia. Nursing intervention education. Communication and education are fundamental components of nursing care process. Communicating throughout the care directly with the patient and her family will empower the family and enhance the outcome. Explain Ali's presentations to Ali and her family that she has an infection in her lungs, which is making her want to cough with lots of phlegm, making her tired and possibly vomiting. With each treatment, whether it is a nebulizer, antibiotic, medication or coughing exercises, explain what is being done simply and why. To assist Ali to understand, explain in her terms many times. For example, you may feel better after a few days, but we need to keep taking the medication to make sure all of the infection or the bad guys are gone from your body. Explain to Ali and her family when to come back and seek medical attention when they leave the hospital. Confirm this all in writing and handouts on discharge, such as handouts from the Royal Children's Hospital. Advise Ali and family if there are any changes if she feels worse. A fever, breathing or coughing gets worse, then see a doctor or emergency department. This reflects the National Safety and Quality Health Service Standard 2, partnering with consumers.
So nursing intervention, individualised patient-centred care is a therapeutic holistic relationship. So introducing yourself to Ali and her mother and family starts the therapeutic relationship. Actively listening and openly communicating to all throughout the time of care supports building trust and respect from both sides, and communicating directly to them and at a level that they actually understand, and making sure that they do understand by having the conversation. So in Ellie's case, valuing her views and also the family. Building a rapport with the patient and the family will benefit the care. So that reflects all the National Safety and Quality Health Standards 1, the therapeutic relationship to implementing processes. Psychosocial, taking into account of the psychosocial aspect of Ali. So this could be the family situation, any relationships with the mother and daughter, relationships with peer pressure, at school, any sort of financial, education, the location, lifestyle, they all impact on her care. And obviously being a 12-year-old girl, you definitely need to take into account of her body image and physical development. So consideration you need to take into account of physical development as well as her intellect and how she's feeling. So something that we may think is just a day-to-day simple task to go to the toilet or have a shower could actually be a bit more overwhelming for her in the fact of being so embarrassing. So just taking into account of just simple things like that